Arpana Jain, Director of Obstetric Gynae Department, Fortis Hospital, Shalimar Bagh. Today we are discussing a very important topic: preconceptional uh, conceptional advice. What one has to plan before planning pregnancy, what to do, what not to do, and what test or what examination need. Is it important to do? Yes, I will say yes, very important. Before planning pregnancy, one should get a complete examination by a gynecologist. The gynecologist must want to know is there is any pre-existing disease if you are planning pregnancy, your cycles are regular or not, because if it is a delayed cycle or irregular period, then it is become difficult to conceive. So gynecologist must be knowing beforehand whether you are having a cycle, regular cycle or not. If you are having any sexual dysfunction like difficulty in intercourse, then it can be dealt before planning pregnancy so that you have a fruitful outcome. Any chronic illness like diabetes, hypertension, any surgeries before planning pregnancy, if done, doctor must be aware of that also, so that it can be dealt with and you will have a fruitful outcome. Any allergy, like allergy to any medication, it should be noted down. And if any complaint like pain abdomen, if somebody is having pain abdomen or any discharge, then one should tell the doctor that you are already having this problem, or urinary infection, like urinary infection. Then should tell your doctor. Family history is also very important, because if there is any chronic illness running in your family like diabetes, hypertension, asthma, thyroid disorder, so then the doctor can examine or test you to know whether you are already having this disease or not, or there is any history of abnormal baby in your family, then one should definitely tell your gynecologist before planning pregnancy, so the doctor can take care of that thing, and if any test required can be done beforehand. What examination usually needed before planning pregnancy? It is usually a general health examination, like a test like doing a CBC examination, knowing your hemoglobin status, knowing whether you are already is anemic or not, and suffering from any infection, or having any medical problem, like you already having diabetes, blood sugar level should be checked beforehand, your kidney function should be done beforehand, and thyroid function is very important. And कुछ इन्फेक्शंस के लिए टेस्ट होते हैं, लाइक टॉर्स इन्फेक्शन. These are the viral infection. If the mother is having viral infection during pregnancy, it can transmit to baby, leading to abnormalities in the babies. Uh, Along with this, some pelvic examination is very important, because by doing a pelvic examination, one can come to know whether you are having any abnormalities in the uterus or in the ovaries beforehand. So one can rule out any fibroid like ovarian cyst beforehand, before planning pregnancy. If there is any difficulty in intercourse or difficulty in conceiving, then partner examination is also required. For that, we can refer the partner to to the urologist. And what are the tests? I just told you, like CBC examination, and torch infection I already told you. Along with this, there is thalassemia screening test, which is very important. What is thalassemia? Thalassemia is two types, like thalassemia major and thalassemia minor. Usually the major, or if somebody is having thalassemia major, one must be knowing beforehand, because it's a very big medical disorder. If it is a minor one, then it can be subclinical, and must not be knowing whether they are having thalassemia, because they say they are mildly anemic, उनका hemoglobin level कभी बढ़ता नहीं है. But in that case, one should do thalassemia screening, in which if you are having thalassemia minor, you will not be having any problem. Your baby will not have any problem. But if your partner is also having thalassemia minor, then the baby can have thalassemia major, which is 25% chance. So one should be knowing that whether she's having thalassemia or not. Specific tests like if diabetes, blood sugar level should be maintained before planning pregnancy. We do a hemoglobin A1C level, whether knowing that what are the previous 3 months hemoglobin sugar level, so that if the hemoglobin A1C level is high, then one should first control the sugar and then plan pregnancy. If she is already hypertensive, one should be knowing her kidney function status before planning pregnancy. There are few many medical disorder. If already having such medical disorder, then one should treat it, control it, and then plan pregnancy so that one have an uneventful antenatal period as well as fruitful outcome of pregnancy and fruitful then have a healthy baby also. What basic thing one should tell before planning pregnancy? If somebody is already having smoking or alcoholic, then one should stop smoking as well as alcohol before planning pregnancy. And weight should be under control. If somebody is underweight or overweight, try to maintain in healthy weight before planning pregnancy. Stress and anxiety, everybody is suffering from stress and having some amount of anxiety. I cannot say that remove it, but I will say try to reduce it by doing some amount of yoga and meditation. One can reduce stress and anxiety. Fertile period, I will tell you later on, and ovulation kit, I will tell you later on. And what are the diet one should matlab, completely avoid before planning or during pregnancy? I would say caffeine, junk food, and cold drink one should totally avoid during pregnancy. Healthy diet, lifestyle, and healthy diet should be taken during pregnancy and before planning pregnancy to have good quality of egg, like leafy vegetable, fruit, salad, egg, yogurt, nuts, and lean meals. Coming to the fertile period, as we know that egg rupture usually 14th day of the cycle. If somebody is having 28 days cycle, then we can pinpoint that it rupture on the 14th day of the cycle, and usually egg remain in body for 24 hours. And the sperm can stay alive in the woman's body for 72 hours. You can see this chart. It is possible the maximum time of best time fertile period which we say is 10th day of the menses to the 14th day of the menses if somebody is having is 28 days cycle. But we say because it is difficult to point out the ovulation time, so it is best 8th day of the menses. And once one start the menses, count 8th day, and till 16th day is the time when there is chances of conceiving. So one can follow this chart and can find out what is the fertile period. And there is another test which is available to know your fertile, whether you are ovulated or not. It is a very small urine, just like a urine pregnancy test. It's a urine test in which you can put a drop of urine in the center and can see if that there is two lines. It means you have ovulated. But I will not recommend it to everyone because it is give lot of stress. I will say only to the patient who are not able to conceive and they want to track their ovulation or having irregular period, then they can use this ovulation kit which is available in the market. Then what are the medication one can start before planning pregnancy? It is always better to start any medication under doctor's guidance. And the one main medication which usually one start before planning, at least 2 months before planning pregnancy, is folic acid. One can start it even before asking the doctor. Folic acid. The rest of the medication like multivitamin antioxidant, any special treatment would that depend on their medical disorder, which should be taken with the advice of doctor. Vaccination is very important. One vaccination is very important, that is rubella vaccination. One can check the status of rubella status by doing a blood test. If somebody is not vaccinated with rubella, not having any immunoglobulin against rubella, then one can take vaccination. But after taking vaccination, 3 months you should not plan pregnancy. Another specific in COVID time, one should can take COVID vaccination also. Another specific requirement, if somebody is traveling to an endemic area for that particular disease, then one can take vaccination of that particular infection, but one has to consult the doctor for that. So I will say it is very important to consult your doctor before planning pregnancy, because one should be aware of any disease, already suffering and controlling that disease beforehand, so that one have a healthy mother and healthy baby, which is the aim of any patient as well as doctor. Thank you so much.